Is there anything kids do specifically at like the younger ages where the parents should start considering coming to see you? Like what sounds and stuff would they be making?
Yeah, so if you're talking sort of in terms of language development, so those early toddler years, if they're actually not using any sort of spoken words and they're relying on pointing or just making sounds like and, you know, trying to get your attention, things like that. Sometimes we just have children who literally don't actually try and communicate with you at all. So what we as a speech pathologist do, we actually look at the child, not just how many words they're using, but we also look at, well, why? Is it because they can't hear you? There might be an underlying hearing problem that's been missed because of a lot of ear infections, or it could be to the extreme where a child might have an undiagnosed autism, for example, that just hasn't been investigated. So there could be something like autism being the reason for their lack of language development, or it could just be something very simple that for some reason they haven't picked up on the words as much as the next child. So when you have children who are sort of that 1.5 to 2 years old who are not using spoken words, it's definitely worth seeing a speech pathologist to see, well, not just how many words they're saying, but why. Why is it that they're not actually talking the way they should? Because we know, based on the research, that children with typically developing language by 18 months are usually using around 50 words. And by the time they get to 24 months, children with typically developing language are actually using about 200 to 300 words and are putting them together in sort of 2 to 3 word sentences or phrases. And so if your child isn't sort of reaching those milestones, then we would look at, well, why are they not reaching those? Sometimes it could just be a simple thing that they just haven't been exposed to enough language, and other times it could be an extreme, like they might have a diagnosis like autism as being the reason. In terms of speech sounds, there's lots of different sounds that need to develop, and harder sounds like the R sound or the TH sound, so they are quite late developing. So if your child is 4 and doesn't have the R sound yet, that's considered age appropriate actually, because it tends to come in by the time a child is 5. TH is the last one to typically develop. It comes in about 6 or 7. So if you've got a 3 or 4-year-old who's still making their speech errors, it's actually considered age appropriate. But then we have other sounds like your and your p and k, and those sort of ones that develop much earlier. So if your 3 or 4-year-old doesn't have those, then that will be considered delayed. So there's actually a lot of different sounds and stages at which they should develop, and a speech pathologist is the one to obviously assess their speech to see, well, which ones do they have and which ones don't, and then based on that we can determine if it's considered age appropriate or if it's delayed.
Should they go to like a government agency first or go straight to someone they find like you? How does it work, like booking in with you?
Yeah, so there's 2 different ways essentially you can do it. There are a couple of public places out there like child health centres and things like that, depending on where you live, but some of them might have sort of a walk-in service where on certain days they might have a speech pathologist there or occupational therapist, those sorts of people. So you can go in and they'll assess your child and obviously determine whether or not this child should see somebody. More often than not, what we hear from so many parents is that they might go in and get assessed, and if they find that yes, this child has got a delay and probably needs some speech therapy, that in those public places they often get put on a waiting list, unfortunately. And waiting lists can be up to 2 years long sometimes, which is quite concerning. So children where early intervention is so crucial that if you've got up to 2 years waiting to even get help, then you know you've missed the mark a lot of the time. So although going through the public system is an option, if your child is not in school yet, trying to actually get help is really, really difficult because of the long waiting lists. Once a child gets to school age, then some schools do have speech pathologists as part of like Education Queensland. But once again, it's not so much a waiting list, but it's actually that children who do have difficulties, it's only those ones who have actually got really severe difficulties that actually would get prioritised. So if you've got a child who does have some speech or language concerns or stuttering that is considered a problem but still on the mild or moderate sort of level, then the school speech pathologist, because they're so there's just sort of not enough funding for them. They don't have enough time in their caseloads. They just cannot prioritise those kids who are just not considered severe enough. So then they either just don't even get identified in the first place, or they certainly don't get the sort of help that they need. The few who may be lucky enough to get some help through school, more often than not end up being sort of in a group therapy sort of situation, which in some cases can be really good, but it's very, very difficult to target speech therapy goals with, say, 5 or 6 other children when all of them have such unique needs. So every bit of help is better than nothing, definitely. But in the public system, it's usually very, very difficult unless you've got a really severe sort of difficulty. So more often than not, we get the parents who may have started with the public journey actually still ending up coming to a private practice. So because depending on how busy the practice is, but generally speaking, provided there's simply enough appointments there or the number of speech pathologists they might have on the team, then you can generally get sort of in straight away. I know that at our practice, I don't like the idea of waiting lists because people usually want the help now. So my aim is to make sure that we always have appointments available. So if we get to the point where we're full, I recruit and hire more people instead, because waiting lists I find just don't work. Because if they can't get in with an appointment with us, they'll bring the next place because they want the help now, and then the next place will book them in. So I try and avoid that, and basically we'll just recruit more speech pathologists instead of having a waiting list. So
that's awesome.
essentially, yeah, you can call up, and depending on how busy the week is, but usually within 1 to 2 weeks, depending on your own flexibility, you should be able to get an appointment with us. And if not, then I didn't do my job well enough, I need to hire more people. So, and yeah, when you do go see any private speech pathologist, you don't have to have a referral from a GP. So usually it's literally just giving the clinic a call and obviously explain your concerns so we can make sure that you're booked with the right therapist who's got the best experience for your child's needs. And we obviously find a time. There are some people who do like going to the GP first to get a referral, but you don't have to have one unless you get a referral for an EPC, which stands for an Enhanced Primary Care Plan. It's sometimes also known as a Chronic Disease Management Plan. And basically what that means is that if your child is eligible, then for up to 5 sessions per calendar year, Medicare will rebate those 5 sessions. And the rebate currently stands at $52.95. So it's only a small rebate, unfortunately. Medicare can be a bit stingy, but you know, something's better than nothing. Mm-hmm. So if your child were to qualify for that, you will need a GP referral for that. But to simply make an appointment or even get advice, you simply contact us. Awesome. And we can talk you through that sort of thing.
Cool. So